Thank you very much, Dr. Tariq. Assalamu alaikum wa rahmatullah. I am really happy to be speaking with you here on a topic which I never thought we will be discussing at this time, which is HIV eradication. As you know, really this is one of the major epidemics of mankind that we have seen from the beginning, at least if you are as old as I am, maybe Dr. Majid or some other people here, Dr. Adil. You know, starting from 1981 until last year, more than 70 million people have been infected and 30 million have died. So it is really a major a scourge of mankind that we have been witnessing. And the situation, so what makes us now really start talking about eradication is, are we justified in talking about eradication of this disease? Are we justified in being excited about what is happening about it? What is the situation and what is the evidence that we can really talk about eradication? This is what I want to talk about today, to see, especially for those of you who have not been with the latest development of this disease. The situation now, really, if you look how many people are infected in the world, we still have about 34 million people infected, and so one can ask why are we so optimistic? But one reason why this curve is not going down is that people who are infected with AIDS are living longer, and this is why this curve may take some time to come down. I want to emphasize the requirements. Before we say we can eradicate AIDS, we have to do at least 3 things. One, to stop the transmission. That means we don't want any new infections. The second is to stop disease progression from those people who are already infected, the 34 million people. And the third thing is to cure those who are infected with the virus. So can we do these 3? What is the evidence that these 3 things can be done? These 3 things are really have been formulated with the WHO in the following. We want 0 new infections and 0 deaths from AIDS-related illness. And the third thing is that we want 0 discrimination. I don't really have much time to talk about this aspect, although it is a very important aspect. And really, yesterday, we saw some from Dr. Nizar and from the group from the high school and from the AIDS patient. We saw a little bit about this important topic. And the reason this is very important is that without 0 discrimination, you are very unlikely to achieve the other 2 before the new infections, the 0 new infection and the 0 deaths. So although we may not have time to talk about it, it's a very important topic. What are the tools that we have to achieve eradication? We have many tools now, really, and all of them are important, although they may play different roles at different places and at different times. HIV testing is something that came up early as soon as the virus was discovered, and that, of course, remains one of the major things that we have that we need to do in order to achieve the cornerstones of eradication is HIV testing, and we call it counseling and testing. We have the anti-retroviral therapy, and of course this has really become a major cornerstone again. And this comes in different forms. We have early treatment, we have treatment as prevention, and we have pre-exposure prophylaxis. Then we have some additional tools like male circumcision, which have proved to be effective. We have behavioral change, which we have talked about from the beginning, before even treatment was proven to be effective. We have things like condom use, also important. And then we have new things like microbicides and vaccines, which still have some questions marks around them. Now, these things may have different effectiveness, and the effectiveness have been estimated in different studies. And just to show you here, for example, the effectiveness can be very close to 100% if we talk about treatment. And this is why everybody is emphasizing treatment because of its effectiveness. The other things which I cannot see very well here, like male circumcision, the effectiveness comes down to maybe 50% or so, and then going down to microbicides and vaccines to the 30s. This is why still these things are not playing major roles. So for antiretroviral drugs, I think this is really the major tool that has changed the picture for AIDS eradication. And as you know, we have many, almost close to 30 drugs that have proven effective against HIV and AIDS. And they come into 6 classes, which you can see here. And they can be used also, of course, in combinations. And it is likely that we are going to have a few more as well. So this is a statement from Coffey and Voldenberg that the antiretroviral drugs are one of the most dramatic examples of successful drug development in the history of medicine. And I think looking at what happened with AIDS, we really must agree with them to a large extent. So let us first talk about stopping the transmission. What has actually been done? Has transmission been stopped to some extent? The answer comes from, if you look at this graph here from sub-Saharan Africa, this is the number of people newly infected with HIV between 2000 and 2011. You can see the curve very clearly going down in the most affected areas of the world. So if you really want to say transmission can be stopped, you just have to look at this curve and see that if you can do it in sub-Saharan Africa, where the disease originated and where it is most common, then you should be able theoretically to do it anywhere else in the world. Unfortunately, this is not happening in some other parts of the world. Like if you look at this part of the graph, in Eastern Europe and Central Asia, it is not happening yet. So the efforts is not taken there, is not being done properly as in some African countries which have taken the effort more seriously. Now, let us go back a little bit about transmission. And as soon as the virus was isolated, the tests which we use every day now in our blood banks were developed, and really it showed that stopping blood transfusion transmitted HIV is a reality, and we can really eliminate all blood transfusion transmitted HIV using anti-HIV testing or P24 or HIV RNA as recently. So theoretically, as is happening in some countries like the United States, the risk can come down to about 1 in 1.5 million blood transfusions, which is almost really like nothing. So theoretically, this is one possible way of eradicating. Unfortunately, of course, like we had just recently in this case with the child Reham from Jizan, some mistakes may still occur because of the human factor. So let me go to the second thing about elimination, which is eliminating maternal fetal transmission. And this, we heard a little bit about it yesterday, and really this is a very nice area where we can say great success has been achieved. Without any therapy, about 1 in 4 mothers transmit HIV to their infants. And unfortunately, we still have around 300,000 children born with AIDS from their mothers. But in the beginning, this child AIDS looked like an epidemic. And then the door was opened for prevention. And now we are talking in 2013 about potential elimination of all mother-to-child transmission of HIV. And I really like to emphasize the importance of this, because if you remember, when the first AIDS or antiretroviral therapy, which was zidovudine, was developed and it was used alone, a lot of resistance came, and really the benefit of that drug became doubtful in adults treated. And people were losing faith in antiretroviral therapy until a paper came with this graph showing that treatment of the mothers can really reduce HIV in the babies significantly and dramatically. So this was really, I think, I consider it maybe seeing the light at the end of the tunnel came from this study about maternal transmission. But of course, to do this, you have to discover all infected mothers and treat them, all pregnant women, and treat them and treat their babies. If you do this, what can you achieve? I think we have to look at the countries which have done the best jobs as far as this is concerned. Like if we take the United States, you can see after really the peak of the epidemic a few years ago, they achieved 95% reduction of maternal transmission, and this is, I think, not difficult to do in countries where treatment is available, provided you detect all infected pregnant women. This is the strategy in the US. It depends on several factors, but universal testing of all pregnant women is very important, and the use, of course, of antiretroviral drugs, multiple therapy, and starting early in pregnancy, and then you follow up with laboratory testing for HIV load and CD4 count and so on. And then infant antiretroviral prophylaxis is also needed, and sometimes you need other things like elective surgery, elective cesarean section, and of course we know that HIV can be transmitted by breastfeeding. So in there, where you can afford it, you can use replacement therapy. But this doesn't have to be only in the rich countries. This is a study, an actual study from Thailand, where it shows that using simpler, cheaper drugs like AZT and nevirapine, you can still achieve good reduction of maternal to child transmission. So in rich countries we can use triple therapy and no breastfeeding, but in poor countries we can use cheaper multi-therapy, but the important factor is that in poor countries, breastfeeding is very important for the child health. So what can be done? I think breastfeeding can continue, provided the mother is being treated during all the time during breastfeeding. And so we can still achieve similar results in poor countries. Now, WHO has guidelines about this, about now using multi-drug regimens. There were some time of experimentation, like one time there was single-dose nevirapine therapy, which did not prove to be as effective as multi-drug therapy, so the WHO has modified its guidelines. And then the prophylaxis should start about 14 weeks in pregnancy, and antiretroviral therapy to mother and infant, and both regimens should continue until the end of breastfeeding. So really now we have a goal of eliminating maternal child, global elimination of maternal child transmission. How far are we from that? We can see here the UN target is now 2015, and this curve shows that really it is an achievable goal. If the curve continues like it is going now, that means the world is on track to eliminate HIV, hopefully by 2015, provided we do the things I mentioned. So maybe this will be the first really end of child HIV. Now let me go to adults and talk about sexually transmitted HIV. Can we eliminate that one? I want to refer to some very important studies. Some of them were mentioned yesterday also by Dr. Ali Omrani. But this study was a very important one, which showed that you can achieve 90% with proper antiretroviral therapy. You can really achieve 90% reduction in HIV transmission from one. If you have a serodiscordant, discordant couples, a man and wife, one of them is infected, you can still prevent transmission between them up to 96% if you do proper antiretroviral therapy. From 28 transmissions, only one occurred where the therapy was started early, while in 27 cases, if the therapy is delayed, and using these well-known regimens of triple therapy. So this is also a big breakthrough that gives us hope that really sexually transmitted HIV is preventable. This is another study showing that rate of transmission can go up from 0 to a very low rate in between sexual discordant couples. What is the impact of this on the population? These studies were done on small groups, but does it work for large, for whole countries or large populations? This was done in South Africa, and it showed that yes, you can still do the same thing if you take, if you study large populations, and you can see the curve going down really with the for sexually transmitted HIV in whole sections or in large populations. Now, so what is the target now for the United Nations? Really is to reduce sexually transmitted to less than half by 2015, and so it will be less than 10% of the peak. Of course, we do not expect this to happen very quickly, but at least the target is there, and if we can achieve this target, we can say we are on our way to eliminating or eradicating HIV and AIDS. Now, yesterday we talked about, we heard about pre-exposure prophylaxis, and this can be done now by oral antiretroviral therapy or by microbicides. This study quoted yesterday showed that you can achieve 67%. This is, I talked about the person, the transmission from the infected to the uninfected by treating the infected partner. Now we talk about treatment of the second one, which is not infected, like the wife who is not yet infected. Can we prevent infection? And the answer is yes, you can do that by pre-exposure prophylaxis. What is the rate? 67% in one study with the tenofovir, and 75% with tenofovir, emtricitabine. And, but unfortunately, we have some conflicting results, and people don't yet know why there is some conflicting results as far as this is pre-exposure prophylaxis is concerned, but at least there are some studies that show effectiveness. How about microbicides like vaginal gels? And this is important because there is a need for a method which is controlled by the women in particular, and of course both of them, the oral and the microbicides, can be controlled by women. And we have lived actually through the what is called Caprisa 004 trial in South Africa in Durban, which showed some 39% effectiveness by using vaginal cream before and after sexual relationships. And this was exciting news, really, but unfortunately there were some conflicting data from the VOICE study which came a little bit later, and still the situation needs to be analyzed why we have some conflict, but microbicides still provide more hope for preventing transmission, sexual transmission. Male circumcision, this was a surprise, but it really proved effective to some extent, as I said, around 50% or so. And this has now been, so it is now advocated very widely in countries which do not have circumcision as a normal method. Now, let me move to stopping the HIV in already infected people so that it doesn't go to AIDS. What happened here? What has been achieved? And really this graph shows very nicely that only since 2005 onward, we are seeing this decline of the transmission from, or the progress from AIDS, from HIV infection to AIDS. Now this is very clear, the trend is very clear, and as I said, this is why more people with HIV are living, and we don't see a big reduction in the total number, but we see it as far as moving from HIV to AIDS. So this is a very nice and clear sign of progress as far as stopping, eradicating AIDS. So actually in 2011, 1.7 million people died from AIDS-related causes worldwide, which was a 24% reduction. A very nice percentage, but unfortunately, really, and this is, I want to emphasize this point as far as we are concerned in many countries, especially in the Middle East. I think the Middle East needs a special lecture on itself, and Saudi Arabia maybe needs even a third lecture by itself, because it doesn't seem that we are benefiting from or at least in the Middle East, maybe my feeling is also in this country, unfortunately, we're not benefiting from what is happening all over the world as far as the lessons learned about AIDS. In the Middle East, unfortunately, there was an increase in the 17% increase, and also in Eastern Europe and Central Asia, there was a 21% increase. So whatever good news we hear from certain countries, it doesn't have to apply to all the world, because unfortunately, some countries are lagging behind in the efforts in using the scientific methods of stopping the transmission and treating the disease. So, if we want to have the end to AIDS, we should not have any new infections and new deaths, and we should really reduce the previous peak at 2005 to less than 5%. That means we should not have more than 100,000 AIDS deaths per year all over the world. Now, what are the prerequisites to achieve this? Really, this is not going to come easy. You have to have HIV counseling and testing at a very wide range, and this should be done in the most effective manner, including home-based counseling and testing. And this is something really is not known here at all, but it has proved to be effective in some countries. And of course, you need to provide antiretroviral therapy for all those who need it. And previously, that ARV was very expensive, so people were talking about 3 to 5, treating 3 million. But now we are talking about treating 15 million by 2015. And this, of course, will be very important. Of course, the price has come down and more effort is now being put into this. And this is happening in certain countries. This is if you just look at the black line in African countries, really the number of people who are being treated has increased tremendously, but still there are people who need treatment who are not yet getting it. And it is important now really to emphasize that treatment has become prevention at the same time. If you treat, you're going to stop the transmission, not only treat the patients, but also protect the uninfected one. So when should we treat? Of course, this was linked to the CD4 count, starting first when the drugs were very expensive. Only people who had less than 200 CD4 were treated. Then it became 350, then 500. And then now really what everybody is saying that any number, anybody who is infected with, no matter what is the CD4 count, should be treated. If this is possible, of course. Some countries cannot afford this. This means more money put into this. But in general, this has been happening, that we can see here the number of CD4 count where treatment is initiated has gone up and up. And okay. So now, really, we have a clear recommendation is that treat and test and treat all HIV. If you can do it, of course, this is what should be done. It's very important to emphasize that when you treat, you should retain people on treatment. You should not lose them, start and then lose them. And if you do this, this has been shown very clearly in Africa. The life expectancy has gone down in AIDS patients from 49 to 60 years in the last few years. Now, so will the treatment of all HIV-infected people reduce the incidence? In general, I think there are the incidence rates. Many models have shown that yes, it can. If you treat everybody, you are going to reduce the incidence very dramatically. Just look at the dashed line here, and it is the best one where everybody is treated. So if you treat earlier and treat all and do, then you're going to achieve this, and hopefully additionally with pre-exposure prophylaxis, and in the future maybe microbicides, things can even improve further. Now let me go to the last point here, the curing the latent infection of HIV. If we do all what I said before, we still have those people who are carrying the virus, and what are we going to do about them? Can they be cured or from their infection or not? And really, we got some exciting news recently on this point, on the point of cure. First of all, we now have some specific examples where cure was achieved. We have 3 examples: the Berlin patient, the Mississippi child, I call it, and then there is a French study showing. Because of the time, I just mentioned that the Berlin patient was the first one to be shown that somebody who was HIV positive was cured completely, but because he was treated with the cell transplant, bone marrow transplant, it's a special case. But only recently, from the conference on retroviruses and infectious disease, there was a nice report about curing a child who was infected from his mother who was treated with early antiretroviral therapy, and this came from the Mississippi group. And it showed that although the mother, after treatment for 18 months, The mother stopped treatment for no reason, and she went away, and then came back after 5 months, and when they tested the child, they found that the virus is not there. So really, this was a very good and exciting news, and maybe this can be replicated, maybe first in children, but maybe later on. They just say that it is the first well-documented case of functional cure in HIV-infected child, and it suggests very early antiretroviral therapy in infants may prevent establishment of latent infection. Of course, we know that latent infection, I have to go fast a little bit, that latent infection is a problem because it leads to rebound in most cases. These are still special cases. The majority of people, if you stop treatment, the virus is going to go back. So we need to understand latency and what to do about it. About latency, latency is the main reason we still need some new drugs to reverse latency latency. What is the status of the virus in latent infection? We know now that the virus, although some of it is damaged, like with deletions and so on, mutations, but at least 12% is still good and active and can come back. So you really need to shake it up. The latent virus, you need to shake it so that it replicates, and then you hit and kill the infected cells. How can this be done? There is a very nice progress now on this front by first looking at what makes the virus latent, and it has to do with histones, and this has led to the use of histone, what is called histone deacetylase agent inhibitors, and there are a number of them here which have now been used. Like this is one of them, vorinostat, which has shown that it can really shake up the virus and so on. I just want, because of the time, I want to say that there is still a lot of interesting area about HIV. For example, some people are spontaneous controllers. They don't get infected by HIV. To understand them, what makes them resistant, we know that at least there are several host factors that make people resistant naturally to HIV infection. We need to understand this. And finally, the vaccines. We have one vaccine which showed, called RV144, which showed 31% effectiveness, but people are trying to teach the immune response to make better antibodies, and we have what is called broadly reacting neutralizing antibodies coming into the pipeline. So really, this is another exciting area, because without the vaccine, still the cost of controlling AIDS is going to be huge. So in conclusion, really, stopping the transmission of HIV and disease progression are feasible, it seems to us now, but requires a lot of work. And that curing latent infection may become possible under certain circumstances, but most likely will require new drugs to activate latent virus, and better understanding of the natural host resistance to HIV may lead to the development of new classes, completely new classes of anti-ARV that will really help us more. And finally, broadly neutralizing antibodies may improve the prospects for an effective HIV vaccine. Now, just one question I want to leave you with. In Saudi Arabia, can we do better than what we are doing? I hope so. But it still really requires a lot of work on our part to achieve this zero صفر للAIDS, and I hope that we do a little bit more and hear better news. Thank you.